this is our last speaker, and I'll say, I think for me, Scott, you are probably one of the first people I met in relationship to my doing work with the opioid epidemic. So at the very beginning, when I first lost my daughter, many people asked me to start a nonprofit. People said, why don't you start a nonprofit agency? Because many people do that as they lose their children and they do things in their loved one's memory. And it just didn't resonate with me. I had a full-time job, which, believe me, Siegal Lifelong Learning is really my full-time job. This is all secondary and my extra work. It has really nothing to do with what I normally do every day. And a designer wanted to help me to make some sort of, if I was going to start a nonprofit, make some sort of graphic for that nonprofit business. And when I went to her and first talked to her, she said to me, oh, you need to meet Scott Osiecki. And at that time, what was your title? Marketing?
External Affairs.
External Affairs or something to that effect. Yes. And I met Scott and talked to him. And this has been going on now, so 5.5 years. My daughter's been gone 6.5 years, and I think I've known Scott for 5.5.
And we were on a panel together.
And we were on a panel together at Park Synagogue, and Scott has spoken for me before in his capacity, his external affairs, and his new capacity now at the ADAMHS board. So I really do owe a huge amount of gratitude to Scott and his support and encouragement to continue doing what I'm doing. Last piece of housekeeping here is that evaluations. Please, 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 please. The baskets are up front. You have 2 evaluation forms. One is for your credit. That's the really long one. So if you are applying for credit, this will apply to you. Please make sure you fill it out and drop it off up front. And the second one is a much shorter, easier evaluation. And you want to hold that up a minute for me? That one's for me. And if you have any suggestions of things that you would like to hear, I'm happy to try to create a conference around it. So please give me your comments on today. Is it too much? Was it enough? Was it informative? Did you enjoy it? All of those things. I need to know. Constructive criticism is very welcome in my world. We're a learning institution. So the evaluation, I don't have it online. It was only in your booklets as you received them up front. And the slides, just so you know, everyone's slide presentations are now on my computer, which means I have them and I will email them out. I think all the panelists are perfectly happy with that. So I will be emailing those out. I have all your email addresses after you registered. So I'll be emailing and sending those out. And if anyone has any other questions for me later, please don't hesitate. I'll definitely be here at least until 5 o'clock after you guys are long gone. So with that, Scott.
All right. Thank you.
Go ahead.
Yes, thank you, Cheryl. And just so you know, the ADAMHS board gave her an award for being a great advocate and a partner with us. So just want to, she's been fantastic for us. So thank you as well.
I didn't mention all my awards.
You should. You should mention
My husband has threatened, though, to get me a trophy case.
All right. All right. I think you should. All right. So I'm Scott Osiecki. I think most of you know me. I know a lot of you in the room. So I was asked to go on for 3 hours because you guys were very excited about staying longer today. Right, Jim? That's what you wanted to do. All right. So the ADAMHS board, just in case you don't know, we're the government agency that does planning, funding, and monitoring of all mental health, addiction, recovery support services, and treatment services for the community system in Cuyahoga County. So, the evolving crisis, right? I'm sure you've heard all about this as you were talking today with all the other great panelists that you have. But just want to talk about 2 things first. Remain the same during this, that it really continues to change and evolve. I know before, I think you heard about the cocaine, that it's in cocaine, and we've been trying to keep in front of it as it's been going on. And also that all the partners that we worked with, right, that we've worked really tirelessly with everybody to try to go ahead and make sure that all the residents of Cuyahoga County would have treatment and recovery services available to them. At the very beginning of it, we were in triage mode, code, right? We wanted to know who, what, when, why, how all this was going on. But the only information that we really had was from the coroner's office on the number of deaths. And that's still kind of like the same today, but we have a grant that we're working on with Case Western Reserve University to actually try to find out where it's going to happen beforehand, to learn from experiences of people who survived as well as the people, their family members that have survived. So, like I said, the first thing we were doing was harm reduction, so Project Dawn. I'm sure Dr. Papp talked about that before. So we knew that we had to save lives, right? So we knew that naloxone and Narcan, that it would work quickly to reverse the overdoses. And that's why the ADAMHS board, we were one of the very first funding sources for Project Dawn over at Metro Health when it began in 2013. And of course, Metro Health got a big grant, so that's why Project Dawn is being funded not by the ADAMHS board anymore, but it's being funded through Metro Health through another grant. And since its inception, I'm sure she told you that there's been 10,000 kits have been distributed and responsible for saving lives of everybody. Now that's also another hard thing to track, right? How many people have been saved by that? Because a lot of times they're not coming back and telling anybody, but people come back to get more, and it's available in so many places free, but it's kind of a hard thing to track. But we know that it must be saving lives because people are using that. The other thing was treatment options, right? So what we did there is we knew at the very beginning of this that there needs for detox services, first of all, that people had to wait for detox. So that's one of the first things that we did was increase the capacity for detox. The next thing is residential treatment. We tried to increase capacity for residential treatment as well, because when people go to detox, right, the next step would be residential treatment. And I could talk more about what we're doing about that later as well. Then we also partnered with the city of Cleveland and Cuyahoga County, and that was to make sure that we had the funding to do that. So today, Cuyahoga County, we have a wide variety of detox services, and a person could get in detox pretty quickly, except for maybe Stella Maris. And the reason why that is, we found out, is because Stella Maris allows smoking, where the other detox centers don't. And when you think about it, it's kind of hard. A person going through detox, and then we don't allow them to smoke, right? So I think we kind of have to look at that a little more, too. They could deal with the smoking after they get the bigger issue, I think, of the opiate addictions. And then we also have a walk-in detox center at St. Vincent Rosary Hall. So people could just walk right in off of the street and say, I'm ready for detox, and they will take them. The fentanyl test strips, I will talk about those in a little bit. And then also medication-assisted treatment. I think I heard Dr. Papp talking about that when I came in, talking about that. So we know that MAT combined with therapy, right, is the best practice and most effective way for someone to recover from opiate addiction. So there may be some other things we have to change, right, because there's a lot of people that think it should be strictly a 12-step program, but we find that the medication-assisted treatment along with the 12 steps, it helps people, so we could do that. So we're working on that as well. And also, Medicaid expansion, when it went into effect, that really helped the ADAMHS board a lot, because people then were eligible to get the treatment services, which allowed us to expand services that aren't covered by Medicaid, all the recovery support services. So that's so we could focus on the prevention and removing barriers, and hopefully stigma will be doing that as well. Then some of the recovery supports, right, that we expanded was sober housing, transportation for treatment programs, peer support programs, including Thrive ED at Metro Health. I don't know, was there somebody here today talking about Thrive ED, or if Dr. Papp did? But we funded that for them first to make sure that that was available. And that's when a person with lived experience with opiate addiction could go ahead and contact the person right in the hospital. But I could tell you more about that later when we talk about some other things going forward. Okay. Oh, and then the transportation, just want to say we did a pilot program with St. Vincent Rosary Hall that we funded it for them, and it was a great success that they had of having people like an Uber or a Lyft go pick the person up, take them to their appointment, and take them back. So I don't know if anybody talked about transportation before, but that was really a great benefit. And then ADAMHS board, we also funded a transportation company and transportation at some other providers as well. All right, collaborations, right? So we are the hub for opioid response in Cuyahoga County. We're the co-chairs of the Cuyahoga County Opiate Task Force. We're an active member of the U.S. District Attorney's Opiate and Narcotics Task Force. And we also host our quarterly addiction recovery advocacy meetings, which I know a lot of you participate in that as well. So what we do is, we're bringing together all the stakeholders in the community. We want to connect law enforcement personnel with treatment providers so everybody could work together and understand the epidemic that we're still in. And then harm reduction programs have increased because of this. Detox and medically assisted treatment have expanded, and all the recovery approaches. A lot of those ideas were from these partnerships that we came up with. Okay, the crisis continues, right, evolving. So we're dealing with a new wave of the crisis, and that's the fact that fentanyl is becoming more prevalent in other drugs like cocaine, crack cocaine, heroin it's there. It's in meth in Southern Ohio, and marijuana as well in Southern Ohio. So it continues to expand. And I'm sure that people talked about it before, the drug dealers, right? They're trying to get more and more people addicted to things, and unfortunately people are dying of their experimentation. So, and we know that it's really turns deadly because if a person doesn't even have a tolerance at all, even for heroin or any opiate, and all of a sudden you're taking it and you don't know, it's very deadly. So we've seen a significant rise in opioid-related death in the African-American community, especially with the fentanyl and the cocaine products. So for this reason, the ADAMHS board, we did a targeted public awareness campaign in the African-American community, and that was on a radio, print, and then grassroots information dissemination. In addition, we ramped up our fentanyl test strip program. So and the idea for the fentanyl test strip program came for one of our community meetings that we had. One of the fathers who lost someone to an opiate overdose told us about these test strips, and they're only $1 a piece. So, and it's not that the board is condoning drug use at all, right? But we're here to save lives, right? We want people to have the opportunity to realize that it's an issue that they're having, that it's a medical disease that they have, and we want them to get treatment. So we want them to stay alive so they could make that informed decision. So in 2018, we provided 15,000 test strips to Circle Health Services, which used to be the free clinic. And that was, they would pass it out with their syringe exchange program. And then in 2019, we provided 15,000 test strips to Care Alliance to distribute at their clinics and through their outreach workers. Then we started the grassroots fentanyl test strip distribution campaign in June of 2019 in partnership with Armin Budish and the county. So the ADAMHS, we worked closely. What we did is worked with local law enforcement and the DEA to identify businesses that were in close proximity to areas where multiple overdoses happened, whether they were saved or whether they were that unfortunately people died through that. So then what we did is we contacted those businesses, and they're in corner stores. We have them in barbershops. We have them in businesses like gas stations on the counter. It's in the restrooms in certain areas. And even some of the churches got involved in it, and they put it in their restrooms. So you see, it says test your drugs. Your drugs could contain fentanyl. There's all the strips are attached to there. They can take them, and then how to use it as well. So we wanted to get it in the hands of many people as we can. So we know that it's working, I guess, because the test strips are gone, and all of the businesses that were there have called us back and they wanted to have more. So what we're doing now for 2020 is we put $30,000 towards the campaign and the test strips, as well as Armin Budish, Cuyahoga County, also did the $30,000. So we're going to be reaching out to more and more places. We sent out a press release, I think it was last week on it that it was going to be, and we received calls from businesses who wanted to take part in it. So that's really interesting too, right? So we're definitely making inroads into people's awareness about the issue, and that it could affect anyone, and we want people to survive. Let's see, all right. I'm talking fast because you guys want to go. That's what I heard. All right. So the opiate lawsuit. So this is the most recent thing about where we're going and what we're doing. So the first wave of the opiate lawsuit settlement resulted in Cuyahoga County receiving about $23 million. And that was just the first settlement. Then we know there was a second settlement with, what, $250 million or something like that. So the ADAMHS board, we worked with the Health and Human Services people at Cuyahoga County and Armand, and we also worked with Council President Brady. So we received $10.5 million that is going to help us to expand programs and help relapse as well. Sorry. So the first phase was called the Opioid Mitigation Plan. So this was the first phase. The second phase of the money, Cuyahoga County Council put it into a separate pot, and in January they're going to start the planning of what that is and to make sure that it's long-term, and not only just for treatment, but also it's going to be for prevention and trying to eradicate this problem that we have. So, and then hopefully the ADAMHS board will be at the table again with that. So what we decided to do, what we came up with, is that we're approximately $5.4 million is going to Stella Maris for additional residential treatment beds, for expansion of their partial hospitalization program, as well as their IOP program. So it's going to be 32 beds, 16 for men, 16 for women, and then they'll be able to serve about 312 people in their expanded programs and 260 in the residential beds. So that's huge, because residential beds are still short in Cuyahoga County. Then we're also doing $2 million to St. Vincent Charity Hospital and Rosary Hall, and they're going to expand their partial hospitalization program and their intensive outpatient program, peer support services that they have there, as well as enhance their intake and assessment process to make sure they have 24/7, 365-day coverage. And we're still working out the details with them. Then we also have $3 million, which is a big investment, to Thrive ED program. And that was an innovative program that links individuals, which are the peers that I was talking about before, so people with lived experience. Right now, they're available in Metro Health 24 hours a day. So when a person wakes up from an overdose, they will ask them if you're willing to see someone, or the peer will just go over and make contact with them and say, hey, I've lived through this as well, you can too, what can I do to help you, can I get you to detox services? And then they help the person navigate the system, and they could actually take the person to detox right away. So it's a really great program, and they see a lot of people. I didn't bring any of the results with us, the tracking, but they are helping people, right? So what we're going to do is we're going to expand that in all of the Cleveland Clinic emergency rooms and all of the University Hospital emergency rooms. Now, the issue with this is that Thrive ED, the organization that does this, they need about 150 peers in order to make this program really work. So we're working with the state to get peers certified, offer more trainings, and orientate them that they'll be able to do this. So, and also, it might not be available a person in every ER 24 hours a day right now, but they would be on call at least a half hour to get there. So it is a big investment in peers, and we know that peer support works, and that's why we have decided to do that. Cuyahoga County is also other things they're doing is they're expanding treatment services in the jail through Metro Health. Got all my papers. They're also expanding sobriety treatment and recovery teams, START teams, in the Department of Job and Family Services, and that's to ensure safety for mothers who are addicted as well as their newborn children. So that's what that program's about. And then they're also doing prevention and education for students. We've expanded drug courts in Cuyahoga County, money, unfortunately, to the medical examiner's office so they can have additional resources to process the overdoses and get the information out sooner to us so we could figure that out. And then they also put aside $2.5 million to invest in a diversion program that would allow low-level drug offenders, instead of being arrested and going to jail, they could go here to start into the treatment program. So we're really looking forward. You know, this is an exciting time to have actually that much money, even that the ADAMHS board has an additional 10.5 to offer these services, but hopefully throughout the upcoming years we'll be able to offer more and work with the county on that. The other thing, legislation, right? So there's been a lot of things going on in 2019. We Meet Your Legislators Series, and we invited legislators, senators, and the House of Representatives and other folks to come and talk to us, to meet family members, and to meet people living with addictions and mental health, just to talk about and have an open conversation back and forth. So there's a lot of legislation going on. A lot of it is on the mental health side. We had 9 pages of legislation synopsis that we had, but just wanted to focus on Senate Bill 59, and I know Dr. Papp was there along with Beth DeJesus at our organization, and she provided testimony in support of that. And that's sponsored by Nikki Antonio, and that's saying to let the Board of Pharmacy would have to train pharmacists so that they know that they could provide Narcan to people without a prescription even. Right, Dr. Papp? Isn't that what that is? Yes, okay. So they wanted, to make sure, because a lot of the pharmacists may not know that. Also, Senate Bill 221, which is Strong Ohio, and that's sponsored by our Senator Matt Dolan, and House Bill 354, which is sort of, it's a brother and sister legislation, and that's dealing with civil commitments of people living with substance abuse, right? So we've been pink slipping people with mental health issues for a very long time. They get committed to the board. We kind of take responsibility. We make sure they get their treatment. So we understand there's reason for pink slipping people with addictions, right? But we got to look at this and we got to really work this out before we would start doing that. Because, people say, and I kind of agree with the same thing, if a person has overdosed so many times and came back, and I don't know how many times that would be, that, you do have a physical illness, right? You need to get that taken care of. So if we could pink slip you, commit you to go to detox, to start to get the treatment, to get a clear mind, so you can go ahead and really make an informed decision on getting better. But then there's a question of, okay, who's going to pay for that, right, when that happens? Also, where are we going to take them, right? We're not going to take people to the psychiatric hospital, so where would we take them? There'd have to be some sort of treatment center. Would we have a place in the community, right, that's not necessarily a hospital? How will we go about doing all this? So the legislatures, they're very excited about helping and doing things, but sometimes when you look at it, they're not looking at all the details that we're going to have to figure out as a system in order to do that. So we're working with our board association to work with the legislators about how can we come up with making this a reality that would be beneficial to everybody. Because in Ohio now we have that you could be committed, but you have to come up with the money up front. And I think in the state of Ohio, there's only been maybe 2 families that were able to do that for their loved one to make sure they got into treatment. So there's a lot of language in there that we have to think about. As well as the mental health side, just to mention what we're hearing in this group too, it's about, with all the gun violence we've had and all the shootings, right? And people are automatically assuming that people have a mental illness, or if the people that were doing it, they were untreated, right? So we have representatives and senators putting stuff through the legislature with that too, but we really got to think all about that too, right, with people's rights, and then whether it's for gun violence or not. But not everybody who has a gun and there's violence has a mental illness or even addiction, so we have to think about that. Okay, so how we all could help, right? You're all here, you're learning today about this. Stigma, which is still a big issue that we're dealing with, although it's getting better, right? Like I said, those businesses are willing to take the fentanyl test strips. The churches, actually, when they were willing to do that as well, that was a big step forward. So, but we need to let people know, right, that substance abuse is a physical, it's an addiction, it's a physical illness. So we need the people to know that they could go ahead and get help. A lot of people are afraid to get help because they're embarrassed or they're stigmatized, so we want to make sure that people know about that. Also, let people know, right, it's not a moral failing. To get involved, remember treatment works and people recover. You're all here. In case you don't know, we have our hotline number, which is 216-623-6888. We also have text. You can text for help to 741-741. So we want to make sure that people know that services are available in Cuyahoga County, and that we'll be expanding them with the opioid addiction lawsuit dollars, opioid treatment. So, okay, so I went through them really fast. I cut through some stuff. I know it's been a long day.
Thank you so much. So I see right away we have one question here.
Jim. Oh, now be nice, Jim.
Always, Scott. A lot of good information, things that I had not known, so I really appreciate that. I said this earlier in the day. We talk about a lot of things, but I don't think we talk as much about the families, and I didn't hear anything in there specifically about educating families, both those who have lost family members, but also to help raise the awareness overall. So
yes, it is. It was in my talking points, but I might have slipped through that.
Okay.
But yes, also we want to get more families involved and want the education, and so people could figure out, right, how to deal with these issues. So thanks for bringing that up, Jim. But we're still working on the family piece as well. We know we have to do that.
And I'd love to be a part of it.
Okay, perfect. All right. Yep.
I have a quick question. Who is qualified to become a Thrive Ed peer?
Okay, so you have to be a person with lived experience, right? There are a series.
What experience? I'm sorry.
Lived experience, right? And lived experience is who said that? A person who was addicted to opiates or any kind of substance abuse issue or mental health, because there's mental health peer support and there's addiction peer support. So to be a survivor, you have to be living in recovery. All the requirements are on Ohio Department of Mental Health and Addiction Services website. They're the ones who do the certification process for it. So there's a series of trainings that a person would go through, as well as testing as well, to make sure that you're completely understanding that. And before, it took a long time to go through, but the state is realizing too that this is really important, so they're trying to amp them up. And I know that we'll be having more trainings in Cuyahoga County in 2020. We're working with the state on that.
That's one of the best things I've heard this whole day.
Mm-hmm.
You're going to take somebody who's working on their recovery, pairing them with someone who gets recovery,
Yes.
understands, and stays with them. Almost like a buddy.
Through the-
Yes.
Exactly.
Buddy system.
Exactly.
It worked in kindergarten. It works with this.
It does. Thank you. Yes.
Who else? Okay.
Can you just repeat that number, please?
Oh, the hotline number? Yep, it's area code 216-623-6888. So it's for crisis, mental health crisis, suicide prevention, addiction, if someone's in that, or if you want information and referral, you could just call that line as well and somebody will be there. And then if you don't want to talk to somebody, you could just text to 4HOPE to 741-741. And those are both 24 hours a day. And that's something available to everybody in the county. So when the Health and Human Services will come up, that's supported by that.
Hold on, Donna, I'm coming.
So it may be too early to know, but a number of years ago, I worked at the free clinic and we started giving out the fentanyl strips. And one of our concerns was that we would, in fact, identify providers of what would be deemed good stuff that the addicts would want to get their hands on. And are you able to comment on whether there's been any sort of negative impact because of distributing these fentanyl detection strips?
What we found out that there are some dealers who are going in and getting the test strips to test. And actually, that's a good thing. I hate to say it that way, right? But then the dealer, because we found out from Department of Justice, right, that dealers necessarily don't want that. Some do. Some people actually want to have fentanyl because they know that it's the best thing, right? And if a drug dealer had somebody die from it, people are attracted to that, right? Part of the disease, right? So, but if the dealers who get them, and they don't want to kill people, they want to keep their drug base going. So we found out that they were taking them, testing it, and then they would cut down the amounts or whatever they would do to cut it to make it that an amount, hopefully, that a person wouldn't die. So first we kind of thought, well, that's kind of a negative that we're helping them, but actually it's a positive then because if they're not giving a deadly dose to somebody. So it's kind of twofold. And like I said, we don't condone drug use, and it kind of says that there's help on that display too for people to call.
A quick question. I've recently seen patients come to our clinic who are seeking out carfentanil in Cleveland.
Okay.
Yeah, they're looking for that.
Yeah.
And on certain drug screens, even if you're able to detect fentanyl, you will not detect carfentanil.
Carfentanil.
So are the testing strips any different? Will you be able to detect that on a testing strip?
Yes, any kind of, what are they called? Analogs, yes, it will detect that.
It will detect the animal?
Yes.
Anything else? One more?
Mm-hmm.
My question is about the test strips.
Mm-hmm.
Can it be made available to providers as well?
Yeah.
So that the client...
Mm-hmm. Yes, some of the providers, we give it to some of our providers when a person leaves against medical advice, they're handing them out. And Dr. Joan has them also in the Project Dawn kits as well. But if you contact us at the board, we'll probably be able to get you some for a provider as well. Mm-hmm. But it's also, when they're leaving against medical advice is when they're being given out.
Thank you.
With that, thank you so much,
Okay, thank
Scott.
you.
I really
Thank you for
appreciate it.
having me. Thank
And
you.
I just want everyone to know it's only 10 after 4. So you have plenty of time to fill out the evaluations. You're all on my email list now. You'll get continuing information about upcoming conferences that I am doing or putting together. I just can't. You have all been here to witness one of my dreams, and that was getting the lawyers and the doctors and the therapists all in one room to really understand how big this is and also how much is being done in spite of the problem seemingly never to end. There are things being done on those front lines. So I thank you all for your participation.